Hey everybody!
Happy Twin Tuesday!
Happy Twin Tuesday! Woo woo! Dr. Johanna.
Dr. Madeline.
And we are awesome twin chiropractors at Atlas Chiropractic Center.
In sunny St. Petersburg, Florida, where we see your whole family, but our jam is pregnant and postpartum mamas.
Absolutely. So, what are we talking about today?
Well, as you're hopping on, say hey, drop some emojis. If we're catching you on the replay, say replay down below to make sure we don't miss you. We love all of y'all who tune in and support us. Today, we are talking about joint issues, like what if I have a shoulder issue or an elbow issue or a wrist issue or a knee issue or an ankle issue? Can my chiropractor help me with that?
Yeah, because I think a lot of times we think that because it's not on our spine that there is no time or place for a chiropractor when it comes to those things. However, we do see a lot of people with those complaints in the office and we do help them.
Yes, yep, we do quite frequently. Usually a patient will be there for another reason. They'll be like, my shoulder is really bothering me today. Can you do anything about that? And you're like, oh, really?
Yeah, so anywhere there's a bone, there usually can be some sort of adjustment that can happen to help that area move better, have better mobility, help it heal faster, help reset the muscles, all of that good stuff, just like spine related. So we can actually adjust shoulders, we can adjust elbows, wrists, fingers, knees, hips, feet.
I think she's gonna do a dance for us.
Head, shoulders, knees and toes. So we can do it all, but I thought it was important to note because we do get asked that commonly, especially on the phone. People may call in as they're vetting who they want their chiropractor to be and ask if we can help with those issues. And of course, like a little caveat is that of course you have to have an exam and a consultation so we can figure out exactly where these issues are coming from, because sometimes, you guys, if there is a joint issue, like we'll just do the shoulder, the elbow, or the wrist, is the nerves in your neck are what talk to this area. So you could have actually had an impact to any of these areas and that could be affected from that impact. However, you could also have stress happening on this nerve here that is a decreasing mobility, causing pain, numbness, and tingling down here. So that's why we do an exam to figure out if there's multiple points of involvement, if it's just one, if it's a nerve, a muscle, a joint, if it's a combo, and so that way we can determine what's the best plan of action to get you to your goals and what you're looking for.
Yeah, I think as well with that is a lot of us have seen a skeleton before, and your spine, everything's connected. So although your shoulder is not part of your spine, the movement in your neck and upper back are absolutely going to influence this joint here. So it is all connected. So we will of course evaluate everything and see, and then we do some soft tissue work in the office as well. So sometimes it's not an adjustment issue, sometimes we have to do some soft tissue work with those muscles around that joint to help get relief and getting them to loosen up so that nerve is able to function with that adjustment stuff as well. So
yeah, because your muscles attach to your joints or to your bones and to your spine, so they act like a pulley system and they should be playing really fair and really well together. But a lot of times when you're having injuries, complaints, weaknesses in that area, they are fighting. They're not friends at that moment. So it's a matter of helping retrain that muscle, get healthier, better muscle memory, and better joint mobility, so then they become that harmonious relationship again.
I would say the area the most that people really don't know that we work on, that we do, that gets they all get great results, but I would say is feet, like ankles. People have a lot of plantar fasciitis or ankle mobility stuff, and
especially if you're a runner and you've never had your feet adjusted before, that's a whole new world.
It is a whole new world, and it's usually a really good
or
idea.
A pregnant mom,
yeah,
oh, that's really nice.
Definitely. So other than pain, we sometimes will elbow stuff is sometimes tendinitis is, so
yes.
That could be golfer's elbow, that could be tennis elbow,
or commonly what we're hearing from people. And then, wearing those braces doesn't fix the problem.
No.
It can help alleviate some of the trigger points and the tightness in there, but it doesn't fix the overall problem. So just a little food for thought on that. Carpal tunnel in the wrist.
Trigger finger
weakness in grip or loss of grip strength is another big one with that.
Yeah. Shoulder pain in general.
Rotator cuff stuff, all day. Almost everyone has an injury to their rotator cuff at some point, because I think we just use it a lot, and our shoulder actually is not made to withstand a lot of weight, which is crazy since, a lot of us go in the gym and we lift and we do different things, or we're doing a lot of overhead jobs throughout our life, and then they just get injured over time, and then we feel it later in life, and we're like, we didn't do anything today, but what's going on here? And that is a very complex joint, lots of muscles, lots of stuff going on. So again, have to do an exam.
Yeah. Hip stuff, hip pain, sometimes like bursitis, which is going to be inflammation of something that's in that tissue, but we can re-look at your alignment of your hips and the movement down your legs as well to make sure that's working and balanced as possible. Knee pain, ankle pain, plantar fasciitis.
Sprained ankles, plantar fasciitis.
Oh, sprained ankles is a good one because I think a lot of people they want to stay away from that joint, which isn't always the best rehab for it. So.
Yep.
Yeah. Let us know if you've.
Yeah, we do other stuff besides just spine. So if there is something going on and you are a current patient, you have not mentioned it, just pop it up, bring it in, we'll see what we can do to help you.
Absolutely. We'll see you next week. Bye.